Welcome to a demonstration of InteGreat EHR version 6.5.1. What you see in front of you is the lobby page. The lobby page is where most physicians will start their day. It contains the appointments that are scheduled for that particular day and the work list that has a listing of things that have come back for the physician to interact with. It could be a lab test, an x-ray report, a prescription renewal. It could be a consultative report from a consulting physician. All of that will come to the work list. Since InteGreat EHR is an internet-based, cloud-based application, we have the ability to link out to many other areas, either internal to the servers for InteGreat, as well as external things such as WebMD, the CDC Travelers Health, all by just web links, and you can link out and go to those areas. The navigation of InteGreat EHR is very straightforward. By hovering over a patient's icon, you can go to anywhere in the record that you desire to go. So if you want to look at a particular piece of clinical information, you want to go to a patient's health summary before starting a visit, go order a laboratory test or an x-ray exam, do a visit and document a patient's visit. That can all be done by a hover and a click over this patient icon. So I'm going to go down to Frank Thompson's health summary and open that up and go through what I would call a very, very typical workflow that a physician would do in their office. The first thing you'll see when you open up a patient's record is any type of alert that they're overdue for. So in this particular patient, we are overdue for a hemoglobin A1C, and we are overdue for a particular immunization. The physician can act on these by actually updating it, sending it to a particular work list for review. I'm going to close this out for the current demonstration. As you scroll down this particular patient's health summary, there are several ways to navigate this page. You can scroll, reviewing all the information, or you can use the tab functions at the top, going to each individual section one at a time. In my workflow, I prefer to scroll. So the first thing you see are health management indicators. The indicators are those diseases that you're actually following for this particular patient, as well as any types of alerts that go with those diseases. So for instance, here's a preventative colonoscopy and a hemoglobin A1C, which is diabetic specific. To go back, I can also say this yellow bar is something that follows the patient throughout the record. It gives you instant access to several things. Again, there's that patient icon to navigate to anywhere in the medical record. Access to the patient's demographics, which includes their last appointment, next appointment, insurance carriers, language, ethnicity, things like that are important for meaningful use. Their medical record number, date of birth, and age, as well as access to allergies, any advance directives, and protected health information, which gives you a listing of those you can share protected health information with. Going to head down to health management categories. Health management categories are those diseases that are registered and that you are following for this particular patient. What health management categories allows you to do is access flow sheets, which gives you a great longitudinal view of this patient over time. These flow sheets are actually populated automatically through interfaces with laboratory, visit entry, health summary pages, as well as others. Significant diagnoses is the problem list for this particular patient. Problems can be acute or chronic. Acute problems can be removed from this list by rule, meaning that if you have an acute problem and you diagnose that and treated it, and you want that to go to the history part of the record within 60 days after the diagnosis, you can have that done automatically, leaving you with just the chronic diagnoses. To review this, usually the MA or the nurse would come in and start to review these parts of the record before the physician does their work. So as I review the patient's significant diagnosis, you'll know that this bar turned from red to black and time and date stamped that this has been reviewed. Same thing will happen with medications. I will go ahead and review those medications, This little red box here is our link to SureScript's RX Hub. So because it's red, it's telling you that there are medications out there in the system that you don't have on your list that were prescribed by other physicians. This will allow you to import those to your medication list and keep the medication list up to date and reconciled from several different sources. Failed medications is just a little different. These are medications that didn't work for whatever reason out there, except for an allergy. So allergies are documented under the allergy section, but failed medications is a list of medications that you really want to be reminded of that they didn't work for whatever reason. So if you have to try over-the-counter medications before going to a Tier 3 drug, this is where you would document that. If you had a medication that caused them to be too sleepy, or they didn't like the taste or size of the pill, and you wanted to be reminded of that, this is where you would put that particular medication. What this list does is trigger at the time of prescribing, if you try to do one of these medications again, that you tried it and it failed for whatever reason. Are you sure you want to try it again? Vital signs are very straightforward, again populated by the nurse. We have the ability, of course, to do charts for those, and these can be printed off and given to the patient. We automatically calculate BMI and BSA, and I will go ahead and review those for inclusion in a note later. Open up the allergy section. If you want to see the history or add an allergy, all of the sections basically work the same. Medications, problems, all work with the same introductory function. So if I want to add an allergy, I simply click on the header, choose the allergy, add it to my list, and then it will ask me what happened. So did they have asthma, did they have a cough, there was an anaphylaxis, and I will go ahead and add anaphylaxis as the reason, and the severity was severe. And I can add any notes to this that I wish to do as well. So saving that off now gives me that particular allergy on my list. The next things you see here are family history, social history, past medical history, and past surgical history. You notice that these are in italics, and what that means is they've been updated since the last time I saw these as a user. I can go and review each section of these, and it will time and date stamp, and you notice the type changes from the bold and italicized version to regular type, indicating that they have been reviewed. Past surgical and procedures are very similar. Past surgical history is those things that have been done as you've updated by history. Procedures are those things you've actually done as a provider. The immunization section is color-coded, so it's easily looked at and saying what does the patient need or what they're exempt from. And if you don't like the way the color coding and the chart works, you can actually use a list. So this patient's coming in for a diabetes recheck. So I'm going to add that as a chief complaint. This comes over from the practice management system. I'm going to open up our Quippe templating system and start this particular visit. The first thing you see is all the things that the MA has checked in the pre-visit workflow. And if there's something that I do not want in my note, all I need to do is uncheck that box and it will not appear. This is also where you start to look at the type of service, the setting. Is it a new patient or existing patient? Did you spend a lot of time or anticipate spending a lot of time in counseling? So I review this as the physician. I'm okay with what the MA has collected, and I'm ready to start my visit. So this is our Quippe documentation engine. You'll notice as you scroll down the screen, there's not a whole lot here except for all the diagnoses that are significant for this particular patient, and that's all been brought into the note automatically. There are a couple of ways you can actually add the documentation elements into the Quippe engine. One is I have a set of favorites. So if I want to put just a regular male physical exam for this particular patient, all I need to do is drag and drop it in. And now all the documentation elements are there for a male physical exam. The other way to get information out of Quippe is to prompt on a particular finding. So if I select diabetes mellitus, which is what this patient is coming in for, I can add any type of detail to that, whether it's type 1, type 2, secondary as such, but I can also get on this particular prompt and bring in all of that information as well. So now what Quippe has done is automatically gone into the system and brought in a specific diabetes set of documentation for the history, the physical, the assessment, and the plan. So let's go through a particular documentation for this. History of present illness can either be typed, voiced to text, it can be dictated in. In our system we are linked to Dragon, so I can actually use that to document this particular aspect of the chart. Patient comes in today for recheck of diabetes mellitus, period. The blood sugar has been running between 150 and 170, period. He has been compliant to his 1800 calorie ADA diet, period. He voices no complaints of chest pain, shortness of breath, or numbness in his hands or feet, period. So I've dictated a short HPI. So let's go down through and do our documentation. Within this medical record, you have the ability to say that if the patient tells you something has changed in their family history, it is very easy to go back. By going to the health summary page again, it'll take you a link back to that page, and you can change whatever pieces of the history that you need to change. So for instance, if all of a sudden we have another diagnosis of hyperlipidemia, and we're going to have that in the father. New onset of hyperlipidemia. And now I've added that piece of history. So now what it's done is it's taken that bit of information, taken it down to my history, and added that to the documentation. So here it is. So let's go ahead and start our note. Let's go to the review of systems. Quippe has the ability to do a documentation by exception. So I can mark this as otherwise normal and then go through and document those things that are different than normal. So I want to document the patient's had a history of chest pain. All I need to do is say chest pain and give it a location. So I've documented in the review of systems that this particular patient's had localized chest wall type pain. So let's go down to our physical exam. The same way to document exists here. So I can do an otherwise normal. The color coding in this is that blue is a normal finding and red is an abnormal finding. If it is underlined, it has been documented before in a previous note, so you can easily go back and look at those again. So let's go down here and say we didn't do a skin exam today, so we're going to clear that off. We didn't do a nail exam as well. We'll say that the rectal exam was abnormal and his prostate was a little large. So now we've documented prostate abnormal. The other ability Quippe allows you to do is actually change the order in which the documentation appears. So if I want my cardiovascular exam above my chest exam, all I need to do is drag it up to that particular position and drop it there, and it will keep it there. The assessment is significant as it gives you the ability to do a primary, secondary, and tertiary diagnosis based on the order that you place them here in the note. So if I take angina pectoris and drive it up here behind diabetes, that'll be my secondary diagnosis. So let's order some tests. Let's do a blood count and a hemoglobin A1C today. I'm going to have the patient continue on the diabetic diet. And if I want to add any other documentation to that, I can right-click this, go into my details, and I can actually put a note on that and give more documentation. 1900 calorie ADA. And now I've documented that. Each one of the sections also has the ability to add free text. So if I want to add a complete free text and physical exam, all I need to do is dictate it into this box. So say I'm done with this particular note. I can see what the note looks like by turning it to a concise view, and it shows only those elements that I have documented. If I would like to save this as a template, I can do so by saying Save Content. All I need to do is tell it where I want it to go, give it a name, give it a keyword. If I've selected findings, either positive or negatively, or I put new findings in, I can save those placements, hit OK, and I've got a template. So let's go ahead and complete this particular visit. So in Quippe, I documented the fact that I was going to run a couple of tests. What Quippe did was go out into the database, link those to those particular orders, and I can choose either an in-office version or send it out to a lab version of my hemoglobin A1C. I tell the system what I want it to do, go up and hit process, and off it goes to the laboratory. It'll automatically code the primary and secondary diagnoses that I picked up on my list of my diagnoses, as well as any other complaints, such as chest pain, which I documented up in the note itself. So to process this order, we simply hit process, and off it goes to the laboratory. Prescriptions actually work the same way. What Quippe did was go out into the system and use a logic to determine where these medications are. So if the medication is found on the patient's list, it will be considered a refill. The next place it will look for that documentation is here in the frequently prescribed medications. If it's on that list, it'll pre-check that as well. At the bottom of the list are any of the other medications that are selected. So since I didn't prescribe any medications within my note, I'll go ahead and refill this particular patient's Actos. And we'll go on to our post-visit tab. So what happened is the system went out and calculated an ICD-9 code as well as a CPT code based on my documentation, as well as any ordered medications and ordered tests. And here is the note that I put together. I will go ahead and give this a description, and then I'll go ahead and process my list. So I need to finish my prescription, do a visit summary, and do a charge ticket. The first thing that comes up is the charge ticket. And if I think this is overcoded as a 99215, I can go back in the system and tell it that it's only a level 3, and it will change that code for me. Here is the list of diagnoses in the order I put those in my note. This is where I would also order any procedures I would do in my note, and they will also be mapped. So if you've done those in the documentation, they will show up here as a code. I can complete my charge ticket and send it away. The next thing it will do is go to the prescription that I have not finished. In the prescription module, first things it does is go through a set of alerts. Drug to drug, drug to food, drug to disease, dose range checking. There also is a pediatric dose calculator. We actually collapse these, so if there's several alerts you can kind of see what they are. But if you want to see the entire alert, you can open that up and see it. You can override all the alerts with one click. So there's my Actos prescription. Defaults to the previous prescription that I wrote, defaults to the previous pharmacy. We have the ability to send a 90-day supply to one pharmacy and a 30-day supply to another simply by duplicating the prescription. So let's go ahead and process this. This is an Are You Sure screen. This is what you ordered. This is where it's going. Are you okay with that? Hit OK, and off it goes to the pharmacy. The next thing that happens is the visit summary. So first thing you're going to see is a list of lab tests that are available to include in the summary. So if I want to include this particular TSH, I can do so by simply checking the medication and having it added to that summary. We'll go ahead and pull up our visit summary template and generate the summary. The summary will auto-populate medications, problems, past medical social history, as well as the assessment and plan for this particular visit. You have the ability to edit this form with any type of free text as you wish. So I'm going to go ahead and complete this and complete my visit. I'm going to have it signed, sent to the work list, and put in the patient's chart. So now all I have left to do is actually approve this particular visit. So I hit approve. I have the ability to send this either by work list or fax to another provider as a copy. Save and close it, and I'm finished with that particular visit. And here is that particular visit we just did. You can open up and actually look at it. At this point in time, if the patient would be coming in for a follow-up, I can actually copy this visit over and do a complete documentation by exception. That is a very typical physician workflow of InteGreat EHR. Thank you very much.